Madeline Leninger is a theory of culture, care, diversity, and universality. She developed culture, care, diversity, and universality theory, also known as culture care theory. She founded Transcultural Nursing, International Transcultural Nursing Society, and the Journal of Transcultural Nursing. She also developed the first nursing research method called ethno-nursing. Her education, she earned her MSN in psychiatric and mental health. She has her PhD in social and cultural anthropology. Types of nursing practice, it seemed like she did a lot of research, but she also worked a lot with children in different countries. Influencing factors: when she was a clinical child nurse specialist in a child guidance home, there were different cultures present, and the interaction of client and nurse needed more help. It was more apparent that there was cultural issues or deficiencies. Core concepts and or assumptions. She has about 11. Some of them are care as essence and central, dominant, distinct, and unifying focus in nursing. Humanistic and scientific care are essential for human growth, well-being, health, survival, and face death and disabilities. Care or caring is essential to curing or healing. There's no cure without caring. Cultural care is synthesis of two major constructs that guide research to discover, explain, and account for health and well-being or human condition. Culture care value, beliefs, and practices influenced by and embodied by worldview, social structure factors, and ethno-historical and environmental contexts. She believed that transcultural nursing could provide meaningful therapeutic health and healthy outcomes for healing. The theory doesn't specifically talk about higher power or reference to God. She does a lot of social structure factors, and then parentheses brings up different vague things like religion or spirituality. The material talks about worldview and social structure factors such as technology, religion, spirituality, philosophy, kinship through family ties, beliefs, structural values, life ways, political, legal factors, as well as other influence ways individuals, families, groups consider and deal with health, well-being, illness, healing, disabilities, and health. But she does not discuss any further details regarding religion or higher power.
Hi, my name is Maria Dual. How has the theory been used locally and globally? Leininger identifies several predicted tenets or premises as essential for nurses and others to use. Diversity and commonalities, that is, the similarities and the differences in a culture, based on the elements of care. What are the practices, what they value, what is important for them when they care for each other. By understanding them, we can produce or provide better therapeutic outcomes or therapeutic practices. The other one is a worldview and social structure factors. That is getting to understand the culture. What is the government, the education, the political status, their beliefs, their family ties, their religion. And as the book talks about it, it's not only a dip in and a dip out of the culture, but getting to know it, grasping it, submerging into it in order to understand and provide better care for the patients. And lastly, the professional and generic care. To understand the culture, we have to understand what are their practices, what are their folks. Some of the ideas or some of the examples that they show is one of them is that they pour gasoline in somebody's head in order to kill the lice. The other one is to eat raw liver when your iron is low in order to improve those levels. So as we know, those are important things to know because they can harm somebody, or if we give them a medicine and they are taking something like a garlic or anything that could potentially have complications or anything else, we need to know those practices that they have. Another thing that Leninger created in order for us to be able to utilize it to assess our patients, to assess their culture and health in order for us to provide better care. Also, it helps us in predicting our research and kind of like guiding our research in order to reflect on the difference and what are the influences on it. The other, lastly, is that way we can comprehend and provide a better holistic care by understanding what are the influences that a patient has. So starting in here, it goes technological factors, religion and philosophical factors, social factors and family factors, cultural values, beliefs, and lifeways, political, legal factors, economic factors, and educational factors. Going and assessing our patients and see what are the influences and what are the expressions and care practices that they have, we can provide a better holistic care. Using Leininger's care models in clinical practices show respect our clients' beliefs, values, and expressions, and establishes a partnership between healthcare providers and clients to ensure safe, beneficent, and cultural congruent care. Provide satisfactory care. One of the things that Leininger didn't like to use, or when she was caring for others, it was the word nursing intervention. She felt that by saying nursing intervention, it was kind of like we were telling the patients the way we wanted it. We were kind of making things the way we wanted it to establish. So she changed the nursing intervention for nursing actions and decisions. And those decisions and actions were actually implemented by asking the patients what were their beliefs, or what was the things that they thought that it was important for them in order to provide that care. As a global interest, we know that using Leininger's theory, we will continue to explore cultures and their care needs and practices worldwide. For the future for the theory, we know that it's a holistic and comprehensive theory, and that by using it, we facilitated discovering related to diverse and similarities in cultures. So by understanding what is different and what is similar in the cultures, we can provide better care for the patients. What type of impact has the theory made in practices and the discipline of nursing? Using Leininger's cultural care theory and the ethno-nursing research method, we led to the discovery and interpretative and explanatory cultural care findings of new theoretical formulations, the evidence-based recommendations to guide nursing practice, the discovery of new kinds of transcultural nursing knowledge, and the cultural-based care that can prevent illness and maintain well-being. How has the theory been used in education and in research? The theory has been studied and used in many schools within the United States and in other countries. Some of the countries that have adopted has been Lebanon, Jordan, Saudi Arabia, Taiwan, China, Japan, and Finland. Other kind of disciplines, including dentistry, medicine, social work, and pharmacy, have reported using the cultural congruent care theory in their teaching, in their studies. They use the cultural care theory and the ethno-nursing method to focus on the care meanings and experiences of 100 cultures. So they've been using this care theory and the ethno-nursing, that is a research method, has been used to kind of understand more than 100 cultures. The cultural care used with ethno-nursing method is a powerful means for exploring new directions and practices in nursing. So by using this cultural care and the ethno-nursing, we can explore, we can improve our nursing practices, and we can understand what are the values of understanding the cultural care regarding Leininger's theory. Thank you.
And I'm Linda Jones, and I'm going to discuss the personal uses of this theory. How is knowing about Madeline Leininger's theory help us with our patients' outcomes? Well, the practice of transcultural nursing addressed the cultural dynamics that influence the nurse-client relationship. Because Leininger theory focuses on this specific type of nursing, or aspect of nursing, a theory was needed to study and explain the outcomes of this type of care. Leininger believes that routine interventions would not always be appropriate for every single culture. This may lead to cultural imposing, cultural tension, or even cultural conflict. I think that as nurses, in order to improve our patient outcomes, we should be open to the idea of, working with our patients, understanding our patients' cultures, beliefs, and values. Also, Leininger reports cultural care, preservation, or maintenance allows the care to be tailored to the patient's specific needs. Learning about cultural care helped me when working with my patients because I was able to, understand the patient's culture, tailor my care to their uses of home remedies and things like that, which allow my patients to be more receptive to the care. They allowed them to stay, it allowed them to continue the care outside of the hospital. And the patient outcomes were improved because the patient was actually compliant by tailoring it to their specific culture versus imposing my culture on them. Madden and Leininger's theory can contribute to our personal role as nurses. How? Because caring is the core of nursing. Culturally competent nursing guides the nurse to provide optimal, holistic, culturally based care. Nurses who understand and value the practice of culturally competent care are able to affect positive change in the healthcare practice for patients of different cultures. Sharing a cultural identity requires a knowledge of transcultural nursing concepts and principles, along with an awareness of the current research findings. Culturally competent nursing care can only occur when patients' beliefs and values are thoughtfully and skillfully incorporated into a nurse's care plan. These practices also help the patient to care for himself and others within their family, their supportive and meaningful culture. Personal take on it is being able to incorporate a patient's care, their culture into their care will relieve stress, relieve anxiety, and furthermore, help us as nurses help our job. Just make our job easier because the patient is not as upset and tense. They're more relaxed and calm because they understand that you appreciate and respect their culture. Thank you so much for listening to our presentation. I hope you enjoyed it, and I hope you were able to learn something from Madden and Leininger's theory. Thank you.